Hello, Dr. Cisse covering anatomy and physiology. Today we'll talk about the heart, okay? If I take the heart, it is a little bit tilted to the left side of the body, okay? So this is the left part of the heart and this is gonna be the right part of the heart. So I'll be dividing the heart into 4 parts, like this and like that. 1, 2, 3, 4. 1, 2 will be the 2 atria. Remember, 1 atrium, 2 atria. And then the 3, 4 will be the ventricles. Ventricle. Ventricle means ventral belly, like little belly. So these will be the 4 chambers of the heart, okay? So 1, 2 will be the atria, 3 and 4 will be the ventricles. Now the heart is in the chest, right? In the thoracic cavity. It will be behind the sternum here, right? The sternum, and then the ribs. The bottom part of the heart will be the diaphragm. It divides, this diaphragm divides the thoracic cavity from the abdominal cavity. You see that? Now, 1, 2, 3, 4, the heart chambers are there because the job of the heart is to pump blood. You can't pump blood if you don't have a space to hold into it. For that, the movement of the heart needs some stability. That is why the heart is located in a bag. And this bag is called the pericardium. The pericardium is like a double layer, like this, and it comes around like this. See it? The pericardium. The reason why it's called the pericardium, cardiac, cardium means the heart, peri means around. But guess what? This pericardium is not just one layer, it's a double layer. But on top of the pericardium, you're gonna see a lot of collagen fibers holding the heart, right? To anchor the heart. That is why that is called the fibrous pericardium. Pericardium. Why it's called fibrous? It's made of collagen fiber. That is why the red one, it's called the serous. Serous just means it comes kind of liquid coming out of the body, right? Serous pericardium. Pericardium. Okay? This serous pericardium has 2 sides. It has a one outside called the parietal, okay? And the one inside called the visceral. Because this visceral is almost stuck to the heart, so I'm gonna just make it like this. They can come together. That is why it is also called the epicardium. Epicardium. Epi means what? Cardium. Okay? So the visual pericardium, right, is gonna be the same. You see how the red line and the blue line almost together. But the muscle of the heart itself, because this is the ventricle, it's like a little stomach here. The muscle is called the myocardium. 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 The inside of the ventricle, the inside lining, is called the endocardium. 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 So basically, if you look at the heart, I have 4 chambers. Each chamber will hold blood. We'll explain that later. The top chambers are called the atria, the bottom of the ventricle. The covering of the heart, from inside to outside, we have the inside lining called the endocardium. The muscle itself called the myocardium, this one. Then the pericardium will have 2 sides. One will be made of fiber, collagen fiber, called the fibrous pericardium. The other one will be like the serous pericardium because it kind of makes the liquid for the heart. Then the outside part of that serous will be called parietal, the inside the visceral, and the inside of it, the space inside is called the pericardial cavity. It's like a space also. This is a cavity. What kind of cavity? Pericardial cavity, okay? And there's a fluid inside called the pericardial fluid, right? Thank you for watching, and I'll see you in class.